So we learned early on, and we deduced this from our own observation, that upper respiratory tract infections in general, did have a strong relationship to vitamin D. Why? Because we observed that most colds and flus occurred in the winter months, and it didn't matter where you lived in the world, whether it was in the northern hemisphere or the southern hemisphere. When it was winter, there were more colds and flus. So looking at this from a more scientific perspective and not just a generalization, some of the earlier studies, this one from 2010. And I would like to point out that I think 2010 was about our peak interest and excitement in vitamin D, where we were discovering how many people were actually deficient in vitamin D and therefore had compromised immune responses. Since then, things may not have been clarified, as we'll see. So this is a study in 430 Japanese children from the age of 6 to 15. And they were given a fairly modest dose of vitamin D, 1,200 international units, or placebo over the winter months. And that's important because some studies study some people in the winter months, some people in the summer, and that is not appropriate. They did actually prove, in this study, they had to prove, not just take word of mouth that the person had flu, but it had to be laboratory confirmed influenza A. So what they did find was an effect, a statistically important effect of this smallish dose of vitamin D. Flu occurred only in 11% of the vitamin D group, compared to nearly 19% on placebo. Now, concurrently, some of these children had asthma. And what they also found was the vitamin D helped reduce the number of asthma attacks. Only 2 occurred in those who were on D, but 12 on the placebo. This is another study in Vietnam. Healthy children, again, it's important to note that they were healthy, and adolescents 3 to 17. They were given 2,000 a day, but they were given it just as one weekly dose of 14,000 or placebo, and they were followed for 8 months. And they found that definitely they proved that that dose did increase the vitamin D levels in the intervention group, but there was no change in the placebo group. It went from 65.2 to 65.5 nanomoles, so no significant change. But they did find a reduction in the influenza group, in the vitamin D group, but it was not statistically significant. But there are other respiratory infections apart from influenza, and they were reduced by about 19% if they were taking vitamin D. Now, again, this is a third study, and this is done in Bangladesh. So these were hospitalized children, and they wanted to know if they had pneumonia, could they give them a big dose of vitamin D and see if they had a reduction in the stay in hospital and the time it took for them to recover. So anyway, they were given pretty large doses these were between the ages of 6 months and a year, and 59 months. So they're given various doses depending on their age. And then after that original big dose, they were maintained for 4 following days on 10,000. And what they found was only the children who were vitamin D sufficient at the time of hospital admission actually had any reduction in the duration of their stay or the time to recovery. But what they also noted was that there was a high incidence of malnutrition in general in the population. And certainly they got an adequate increase in the vitamin D, but it may not have been sufficient to impact these children because of the concurrent malnutrition. So this is looking at adults, again, taking healthy adults and saying, is the amount of vitamin D you've got in the blood going to impact the incidence of viral infections, respiratory tract infections you've got? And it's a relatively small study, and it was conducted over the winter months, which is appropriate. And what they found was you needed a concentration of 30 nanograms per mil. Now, in the US, that's the units you use for measuring vitamin D, 25 hydroxy D, or nanograms per mil. In many other places, including Canada, it's nanomoles per liter, so that would be 95 nanomoles per liter. And if you had those blood levels, it was associated with a twofold decrease of actually getting the infection and a marked reduction in the number of days ill. So then we get systematic reviews. This is where you lump together all studies and see if you can draw a general conclusion, remembering that the studies may have been designed differently. So when they looked at 25 of these studies and analyzed them together, what they found was no matter what was the study design, all studies and all doses of vitamin D gave a modest 12% reduction in respiratory tract infections. But those people who were given daily or weekly vitamin D doses, there was a 19% reduction, but no benefit of a bolus. That means a large amount given at one instance, or monthly dosing. And in fact, personally, I think that weekly dosing isn't even appropriate. I think daily dosing is more efficient and effective. For those people who started off with very low vitamin D, in other words, they were deficient in vitamin D, there was actually a 70% reduction in respiratory tract infections. So low dose, low blood levels are the people who benefit the most.